I was diagnosed in December of 2014. Shocker, of course. You know, I thought I was doing everything right and was actually at the hospital doing a visit when Kelly called me. Chose to do the lumpectomy first and then went through several rounds of chemo and then, of course, weeks and weeks of radiation. That recovery went well. I thought I was doing all the right things, and then all of a sudden, 2.5, 3 years later, it's back.
Going through it once was hard. It was even tougher the second time. But working together, working hard, we did it before, we can do it again. And this time, we're gonna make sure that we not only beat it again, we also get on the front lines and start helping other people.
You know, it's always about, it's okay to be in that little pit situation at first, but you gotta bounce back. And then just realize my circle of care at that time meant more than anything, especially people that were positive. And so I'm still grateful that my mom and Willie and Zoe were there.
The circle of care has to start at home. And when you have that good foundation at home, it helps the patient. It's not how you start, it's how you finish. And that's the number one thing I kept telling Rita. I kept telling her that. I know what you're thinking, but it's not over.
Every one of our patients is a survivor from day one. I mean, there were tough times, but really, she's a remarkable person. And it was an honor to take care of her because she encouraged us often more than I felt like we encouraged her. We have to remember that we do this to live, not to be. And when we go forward with that philosophy, even during the hardest times, whether it's through chemo or radiation or surgery, the patient's able to still live a life, whether it's their family coming alongside of them and reminding them the importance of doing what they can do, of laughing, of being involved in others' lives.
My family, they had to be there to help me walk around, to do some of the basic things like using the restroom, showering. It was a long, almost 12 weeks for that initial recovery. Then after that, going through the different types of therapies, whether it was for mental, emotional, and definitely the physical. You used to look at it like, oh my gosh, this hurts so bad still, but now it's more, you made it. It's just a sign, this is something small. Think about what you've gone through. This is minor compared to that.
Nobody knows the future but God. All we have is right now. So I would say, and definitely give to the foundation to help. I would encourage them to give because you never know who you're helping. It could be a family member, it could be somebody that you don't know.
It is important to give your time and your talent and whatever gift you have to this cause, because through the foundation, they look at the total person. They want to make sure that not only the person is okay physically by having mammograms and dietitians and therapy and workout facilities, hate that. They want to make sure that you are completely taken care of. And they understand it's not just about you, it is about the circle of care. So they have extended services, counseling services, people they can call, outlets there where they can say, hey, I'm not okay. So it's important to know that it's the total care that you're funding, that you're helping, and you're helping people right in your community. Same thing with this diagnosis. You're giving to the foundation, giving to the hospital. You're not just looking at that one person. It's the community of people that you're helping.
At Jim Hudson Automotive Group, we're proud to be the survivor sponsor for this year's Circle of Care campaign because I know firsthand that a cancer diagnosis is life-changing. Yet surrounding our survivors is that circle of care, family, friends, and healthcare providers who support, encourage, and guide them along their cancer journey. Please consider giving during the month of October and make a photo tribute to honor a survivor or caregiver. Your contribution funds programs and resources for patients at Lexington Medical Cancer Center that support them during every part of their recovery to survivorship and beyond.